Chronic kidney disease, 12 important signs to not ignore. What exactly is chronic kidney disease? An abnormal kidney blood test, urine test, or abnormal renal imaging that lasts for at least 3 months is referred to as chronic kidney disease or CKD. Since kidney disease is a silent disease, most patients do not experience any symptoms until the condition has evolved to a more severe state. Liver illness is a silent killer, as anyone who has experienced it, is experiencing it, or knows someone who is suffering from it can attest. The fact that a majority of victims only receive a diagnosis at a fairly advanced stage makes it even more deadly. Few people have the education necessary to understand that kidney disease symptoms are not quiet, but they are common enough for them to ignore. Sadly, in some instances, the symptoms might not even start to appear until the situation is serious. This makes it even more important to be aware of the signs. Don't forget to set a notification and subscribe to our channel before we start, so you won't miss any of our new videos. Here are the top 12 kidney disease warning symptoms that you should be aware of. The first indication that you have kidney disease is a change in the quantity and frequency of your urination. The amount of urine you pass could drastically increase or decrease. Additionally, you could occasionally notice that the color of your urine changes. When you get to the bathroom, you can still experience this strong urge to urinate, yet be unable to do so. The main line here is that it's important to start paying attention to your schedule and recording your daily trips to the bathroom if you notice a change in your urine function. Number 2, difficulty or pain while urinating. You may experience pressure or pain while attempting to urinate. You may have a urinary tract infection if this does happen. Although this is easily treatable, it's best to discover it early because it may spread to your kidneys and can cause neck pain, fever, and other symptoms. Number 3, blood in the urine. This is one of the symptoms that is obvious and should immediately raise suspicion. So don't disregard it if you see it. Urinary blood is a clear sign of renal dysfunction. If this symptom has occurred, you should see your doctor right away because a number of bladder tumors may also be linked to blood in the urine. Number 4, foamy urine. I know you probably assume that a lot of these symptoms only relate to the bladder, but because the bladder and kidneys are so intertwined, the bladder is the first organ to be impacted when the kidneys fail. Number 5, swelling or edema. Your kidneys remove all the extra waste and fluids in your body. When they are unable to do that, your body begins to accumulate additional waste and fluid. The person who experiences this will feel tightness in their hands and ankles, puffiness in their face, and swelling in their feet and ankles when this does happen. Number 6, extreme fatigue. A hormone called erythropoietin, which aids red blood cells in carrying oxygen, is produced by healthy kidneys. The levels of this hormone dramatically decrease when your kidneys aren't working properly. Your body becomes tired, exhausted as a result of this unexpected decline in red blood cells. Number 7, dizziness and difficulty concentrating. When your kidneys make you tired, the brain is also impacted by a lack of oxygen. You might feel lightheaded as a result of this, and your concentration on tasks may be challenging. The brain operates more slowly when there is a lack of oxygen, and these will be felt as lightheadedness. Number 8, constantly feeling cold. Kidney disease can cause your body to become anemic, which can make you feel cold even in warm environments. A fever and chills can also be brought on by a kidney infection known as pyelonephritis. Number 9, skin rashes and itching. These symptoms are frequently misdiagnosed as allergies or other illnesses, but these rashes may actually be signs of renal failure. Renal failure, which also results in waste building up in your blood, is what may cause this. This is what likely causes skin rashes and intense itching. Number 10, a metallic taste and ammonia breath. Kidney disease raises the blood's urea level, and when this happens, the urea is converted into ammonia in the saliva, which results in ammonia breath or unpleasant breath that resembles urine. Number 11. Constant nausea and vomiting. If your kidneys are failing, you will constantly feel sick to your stomach. This feeling won't just happen once, but will be ongoing. This is because the body's accumulated waste products need to escape the body, which is why vomiting likely occurs. Number 12. Shortness of breath. If kidney disease has progressed to an advanced stage, it may result in a buildup of fluid in the lungs and may leave you feeling short of breath. When you have anemia, your body doesn't produce enough healthy red blood cells to supply your tissues with enough oxygen. Being anemic or having low hemoglobin can make you feel exhausted and frail. In addition to this, your body will deprive itself of oxygen if you have anemia, which is another kidney ailment. How quickly does kidney disease progress? The progression of kidney disease can be very different from person to person. In general, there are several things that can make kidney disease progress faster, which include the following: long-term use or large doses of certain pain medications called NSAID. Uncontrolled blood sugars and diabetes can also be a cause. Uncontrolled blood pressure, uncontrolled cholesterol, obesity, smoking, and other factors. The risk of chronic kidney disease, if left untreated, can result in chronic kidney disease and can lead to complications and progression to end-stage renal disease, also known as ESRD. These typically occur when the kidneys are functioning at or below 10% of their full capacity. The result: kidney disease, kidney failure, and ESRD. How is chronic kidney disease treated? Early detection and treatment of the underlying causes of kidney disease may help prevent progression. When chronic kidney disease is diagnosed prior to developing into kidney failure or ESRD, some of the following modifications or treatments could help restore kidney function by addressing the underlying cause for kidney disease: dietary adjustments, medication to treat anemia or high blood pressure, modification of current medications such as NSAIDs. It's crucial to keep in mind that even if you experience any of these 12 symptoms, kidney impairment may not necessarily be the cause. Many of these symptoms are signs of other illnesses and infections, but if you have any of them, you should talk to your doctor immediately. Your kidneys and even your life could be saved by speaking with your doctor as soon as possible. Liked the video? Please share your comments below. For more videos like these, click the like button and subscribe buttons on our channel, and thank you once again for viewing.